Do you guys like to exercise and get out and get active? There's actually a really good tool that you can get from Breathe Pennsylvania called an asthma toolkit, and it's going to have some different things in it that are going to help you, especially as you're getting ready to graduate high school and go to college. You're going to be managing your asthma a little bit more on your own. So having tools so that you can help recognize when you're having trouble is going to help you take care of your asthma a little bit better. Some of the tools you're going to get are a spacer, which is going to help you take your medicine, and a peak flow meter. The peak flow meter is actually a tool that we use to see what's going on with your lungs, and you can actually start to recognize an asthma attack even before the symptoms occur. So using it on a routine basis is going to help you take better care of your asthma. Now, what it does, like I said, it measures that expiratory flow. When you take a big deep breath in, you're going to blast it out. It's going to help you determine any constriction that's going on, any of that mucus or inflammation. And when you do this, the first step is actually determining what's normal for you. Everybody's lungs are different, and to figure out where your peak flow should be, it's going to be based on how tall you are, if you're a boy, if you're a girl, how old you are. So you have to first determine what's called your personal best number. And to do that, when you get your asthma toolkit, you actually will take your peak flow meter, and when you're not having any symptoms of your asthma, you will perform the peak flow meter in the morning and then again in the late afternoon. And each time you use your peak flow meter, you should use it 3 times, and then record the highest number that you're able to get when you do your peak flow. Once you determine your personal best, that's a number that you should review with your doctor. So after you've received your toolkit and you've used your peak flow meter and you're comfortable with it, you can talk to your doctor about your best number, and he can help you determine what's called your zone system. The zone system is basically going to allow you to see what's happening with the lungs as they're changing, and sometimes even before the symptoms. The zones are based on red, yellow, and green, and when you figure out what your number is, then you can figure out what your green zone is. If when you do your peak flow, if you're in your green zone, that means that whatever you're doing to manage your asthma is working properly, and you don't need to make any changes. So if you're taking your inhaler or your maintenance drugs, just keep doing what you're doing. You're good to go. If you're in your yellow zone, that's a caution. That means that maybe something is changing, and you have to remember there's all kinds of different things that can induce asthma. Exercise, allergens. So using your peak flow meter is going to let you figure out what's causing your asthma to occur. So if you happen to see it, around springtime, then you might know that you need things for your allergies and those kind of, if it happens to be when you're exercising, then that will let you know when you need to take your medications there as well. So the yellow is kind of just a good indicator that you need to make sure that you're taking care of yourself properly. If you're in your red zone, that lets you know that you're actively having an asthma attack, and that's a medical emergency. You want to step in and take care of yourself, get medical attention, get help. So you want to do those different things, and that's why this becomes such a great tool to use, especially once you're on your own and have to manage your asthma by yourself. So to perform a peak flow, what you're actually going to do is you want to always make sure that the indicator is reset to 0. So you push it down here, and then you're going to stand up nice and tall. I'm going to have you do this here in a minute, and you can go ahead and sit there for a second. Push it down to 0, stand up nice and tall. Take as much air into your lungs as you can. Nice big deep breath. Make a nice tight seal on this mouthpiece here, and then you're going to blow out as hard and as fast as you can, like you're trying to blow out birthday candles right across the room. So big deep breath in and then blast it out. And then again, we'll do that 3 times. So if you want to go ahead and give it a try here, go ahead and stand up nice and tall. Reset your indicator. Nice big deep breath in and blast it out. Good. Now on this next one, blow out a little bit faster. You want to really get that maximal push behind that so you can measure that fastest flow that you can achieve. So nice big deep breath in and blast it out. Good job. And one more time. Good. And as you're doing that, you can write it down so that you know what your numbers are, and then record the highest one. And then keep track of that so that you can monitor when you're having changes in your asthma. So you can see that everything's okay and know when to take your medications. Like I said, one of the other things too with exercise, it's going to take planning. So you're going to have to make sure that if exercise is one of those triggers, if you're seeing that your peak flow changes during times that you're exercising, that would be when you would want to plan ahead. And one of the things that you can do is you can actually take a medication, an inhaler, before you exercise, and that's going to keep you from having those symptoms. So you can use your spacer that comes in your kit and be able to treat yourself properly. If you're exercising and using the inhaler and you're still having symptoms and you're still having changes in your peak flow, that would be a sign that you would need to talk to your doctor. And in those situations, maybe the inhaler alone before exercise isn't quite enough, and you might want to use different medications or different control to help alleviate those symptoms.
Remember, a peak flow meter measures how well air moves out of the lungs. Your personal best is determined by taking readings for 2 weeks, 2 times a day, early morning and late afternoon. Use your inhaler before exercise according to your physician's direction. Consult your physician if symptoms persist.